What I'm about to show you are the labs of a woman that is in her 30s who's been dealing with infertility, weight gain, fatigue, irregular cycles that are going 40 to 50 days long now, cystic acne, hair thinning, and this has been going on for 5 years now. She's been to an MD, an OBGYN, 2 different naturopaths, and like most people we see, she's tried everything under the sun and nothing's working. She's not seeing any improvement in her symptoms, and this is the vast majority of cases that we see. So let's look at the labs that we did, because we did very comprehensive testing for not only the hormones, but her thyroid as well. So let's see what was causing her symptoms.
This is a section of her Dutch test where we are looking at a whole page on her adrenal glands. And really the things to note is that her 24-hour free cortisol, which is showed in a graph here, super low. So no wonder we're fatigued when the adrenal glands are totally tanked out and we don't have enough cortisol left to produce.
Now we are looking at all of her sex hormones. So we have androgens in the top, estrogens here, and her progesterones as well. So her progesterone is terribly low in all three categories, along with her testosterone too. DHEA is looking pretty good, but the most dominant forms and most potent androgens are on the higher end of things. And those most dominant androgens contribute to hair loss, cystic acne, and even cysts on the ovaries, also contributing to very long cycles too. And her estrogens. So these, the first one looks pretty darn good, but the rest, low, 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 and trending low as well. This is another reason that cycles can go long, because she is not able to build up her hormones. And aside from what you're seeing there, everything's low across the board. Then on her blood work, she has higher liver enzymes that are elevated there, and even while fasting, still having an insulin up at 14, which is way too high. On this page, her triglycerides are high, cholesterol is high, her HDL cholesterol is low, and her LDL is high. Also, the CRP up at 6.4, that is supposed to be less than 1. She is highly inflamed and chronically low vitamin D as well. On this page, we have a full thyroid panel for her, and we're seeing that reverse T3 is starting to get elevated, and her T uptake as well. She does have some antibodies present. The correct number for these antibodies should be 0. So even 1 is something that we want to pay attention to. Her progesterone is very low, and these darn estrogens, for being in her 30s, these are some of the lowest estrogens I've seen for a woman her age. So after a few weeks of starting up with us, she said that she's starting to feel like she's 21 again, which is awesome because we're supporting her hormonal pathways. So we started with a couple certain herbs that are going to help with the conversion of her androgens and her estrogens down into those hormonal pathways that we just talked about. So we also supported her adrenal glands based on those labs too, and that was a big part for her. And going on, we were able to keep her stress down nice and low, and going after the insulin as well. But addition to those changes were changes in food, changes in her lifestyle, and now her cycle is getting down to almost 30 days. So it's only been 3 weeks. So if you are in need of full comprehensive testing on your thyroid, on your hormones, with a clear plan to get you back to normal, comment below or message us and we'll reach out to you.